Thank you very much, and thank you for allowing me to give this talk. I am Dr. Harner, a resident at Augusta University Medical Center, and I'll be talking about urban-rural disparities and the utilization of minimally invasive surgery for colon cancer. We have no disclosures to make. So colon cancer is the leading cause of morbidity and mortality in the United States. Fortunately, minimally invasive surgery is becoming a more common treatment approach for this disease and has led to better outcomes. So reduced length of stay, reduced postoperative pain, and as well as decreased surgical site infections. Unfortunately, like Dr. Horsey alluded to in his talk, there exists some disparities in the utilization of minimally invasive surgery. Patients with lower income status or those without private insurance or minorities are undergoing this platform less frequently than others. And so our hypothesis was that patients living in rural areas may also undergo MIS less frequently than their urban counterparts, and this may lead to worse outcomes overall as well. So we utilized the NIS database for our study, and it looked over an 8-year period. And in total, we identified about 96,000 patients with a diagnosis of uncomplicated colon cancer. And from there, we stratified those patients into either being classified as urban, that is living in counties greater than 250,000 population, or rural, those patients living in counties with less than that. And we then further stratified them based on what type of surgery they received and then compared outcomes. So this is kind of a dummy down version of the overall trend and what platform was used for surgery over the study period. And this is taken all comers. You'll see open surgery declined significantly throughout the study period with an increase in both laparoscopic and most notably robotic surgery over the past 4 or 5 years. However, when you break it down based on the patient location, up top we have patients in the urban setting. The red bars representing open surgery you'll see is less proportionally compared to those patients in a rural setting at the bottom of our screen here, where open surgery predominates in comparison to a laparoscopic and robotic platform. Looking at some of the outcomes in hospital mortality, higher for open surgery, however, disproportionately higher for patients in the rural setting. Laparoscopic surgery and robotic surgery, no significant difference in mortality. And length of stay, higher, of course, for open surgery, but no significant difference seen between urban and rural patients as far as that outcome goes. When we look at complications, there are about 14 complications we looked at overall. Open surgery, higher, of course, in general. However, interestingly, urban patients tended to have higher complications associated with open surgery compared to laparoscopic, where the reverse was true. So patients in an urban setting tended to have fewer complications with laparoscopic surgery, and no significant difference seen for robotics. So in conclusion, there is an increased use of MIS for the treatment of colon cancer. However, there seems to be a lag in its utilization for patients living in a more rural setting. And there's difference in outcomes that we see as a result of this. And so appropriate referral to centers accustomed to performing minimally invasive surgery, either laparoscopic or robotic approaches, may decrease this disparity and improve outcomes overall. Thank you.